Not with it yet this morning. Right. Good morning and welcome to this meeting of Health and Wellbeing Board. I'm Councillor Heather Codling, Chairman of Health and Wellbeing Board. Before we start, I would like to explain for the benefit of members of the public who may be watching that today's meeting is being held in a hybrid format. We have a quorum of board members in the room with other board members attending remotely. Only board members who are in the council chamber can take part in any formal vote. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. Gordon Oliver is the clerk for the meeting and Thomas Radbourne is the Zoom host. Also, please note there is that a test of the fire and lockdown alarms are planned for 10 a.m. In the event of an actual fire alarm, we must leave the building immediately via the emergency exit. The assembly point is the Dolphin car park. If the lockdown alarm sounds, we will remain seated and await instruction from officers. We will adjourn the meeting until such time as it is safe to proceed. Do we have any questions about how the meeting will be conducted? Right. Gordon, do we have apologies, please?
Yes, Chairman, we've had a few apologies. We've received apologies from Councillor Jeff Brooks, Patrick Clark, Joe Stewart and Dominic Bowick, and also from Dr. Abid Irfan, Gail Muirhead, Superintendent Andy Penrith and Anne-Marie Dodds. Right.
Thank you very much. And Helen, you're substituting, aren't you? Thank you very much. So, okay, thank you very much. Right, so if we're happy, we'll move on to the minutes of the last meeting held on the 12th of September. Is everybody happy with those? Are there any changes required to any of the minutes? No. Can I have a proposer to accept those then, please? Oh, and a seconder. Yeah, thank you very much. So if we can take a vote then, those for accepting the minutes, please. Thank you. That's everybody. Thank you very much. And I need to sign these. Thank you very much. Right, moving on then to item 3, actions arriving. So, Gordon, do we have anything we need to highlight on here?
It was only if there are any updates, Chairman, if anybody's can update.
Yeah, has anybody got any? Yeah, Helen.
On item 245, I believe that has been completed. It wasn't completed quite in the way outlined here, but a response was provided from BHFT, Welsh Healthcare Foundation Trust, with regards to how that will be taken forward. And I think, sorry, item 267 is also shown in progress. I think really that is now ongoing work regarding the development of our place-based partnership programme. That action has probably moved on a little bit since the action was originally put onto the list.
Thank you very much. Anybody else have any updates on the actions from previous meetings? Can't see any hands up. No. Right. Thank you very much. Moving on then to declarations of interest. Do we have any declarations of interest from anybody? No, nothing. Okay. Do we have, moving on to public questions, do we have any public questions at all?
No, Chairman, no questions received.
Okay. And have we received any petitions?
No petitions have been received.
Thank you very much. Okay, so moving on to the standing item of membership of the Health and Wellbeing Board. Changes in personnel. We've been informed that Dr. Heike Veldman is standing down as the ICB's clinical rep. Helen, do you know who, if anybody, has been identified as a replacement?
Thank you. So no, that is still an ongoing discussion following the agreement of the ICB operating model. So we're intending to send an update out to stakeholders in the next week regarding key appointments and progress on implementing the model, which will also confirm the ICB executive sponsors for each place, and linked to that any revisions to memberships of health and wellbeing boards and other similar meetings, which will include picking up the question of appropriate clinical input.
Thank you very much. I'd just like to just have minuted that my thanks for Dr. Veltman, because I think she always had a really good input and some, useful experience, and was always a very active member of the board. So thank you. Is Rebecca Morgan here from SNG? I can't see the screen. So.
I am. Yes, hi, Heather.
Okay, wonderful. So I'm glad to see that we have a representative now. Are you going to be our permanent representative on this?
I will indeed. Yeah. New assistant director for SNG for the area. So yeah, I'll be attending these moving forward.
Okay, wonderful. It's good to have you on board. Thank you.
Thank you.
Gordon, are there any other changes that you're aware of on this list?
No, I think that is it.
Yeah, the only other one I did want to say is Superintendent Andy Penrith from Thames Valley Police, I don't think has attended for a while. So whether we need to pick that up as well. So I can leave that one with you to. Thank you. Okay, then moving on to item 8. Oh, sorry. Denise.
Good morning, Chairman. Yes, I'm going to be attending, not in an official capacity, but as I'm housing portfolio holder, I thought it'd be useful for me to attend these meetings, but I'm not here as an official member.
Thank you. I think we're moving on. Later in the agenda, we might try and adopt you as a more permanent member of the.
Okay.
But no, it's good to have you as well with the housing experience.
Oh, okay. Thank you.
Thanks, Denise. Oh, and April, sorry.
Just a really small amendment. My service has changed and my total's changed on that list.
We'll get that updated.
Okay, thank you.
Thank you very much. And congratulations as well. Right, okay. I was rushing on there. So moving on to item 8. Building Berkshire Together update. Alison Foster, I can't see the name, so yeah. If you would like to present this item for us, thank you.
Hi, can you hear me okay?
Yes, we can, thank you.
Great, lovely, thank you. I've got some slides. I don't know how you normally do it. Do you do the slides, or I'm happy to share my screen?
How do you want to do? You should be able to share your screen, and then you can move it on as appropriate.
Okay, it says disabled share.
We'll get that sorted. Won't be a moment. Thank you.
Can you see my screen now?
Yes, we can.
Lovely. Okay. So thank you for inviting me just to give an update and to talk about some key items that are happening with Building Berkshire Together, which is the Royal Berkshire's new hospital programme. I'm just going to talk a bit about the programme background. There may be some new people on the board since we last brought anything to the board, and give a quick programme update. We have been working on a location-led impact assessment. I'll talk a little bit about that a bit later on, but certainly West Berkshire residents have been involved in that, and what our next steps are. So a bit of background. The new hospital programme is a major government programme investing in hospitals across England. It's about being a centralised programme using a common set of designs to save money and time. And this is called Hospital 2.0. So standardised design, centralised processes, fully digitally enabled. It's basically building hospitals of the future. It takes anywhere between 5 and 10 years to build a new hospital once you have the funding and it's all been agreed through a business case. So it's going to be some years before we see the hospital, and so we have to be constantly thinking about what does that hospital look like in the future. We're currently scheduled to start construction in 2031. And that means that we'll be leading up to that. We have a business case process as I outlined. If we're moving to a new site, we have to secure that site and we have to enable that site for a build. So there's quite a lot to do before 2031. So it isn't that we're just starting in 2031. There's a heck of a lot of work before then. And there is a new hospital programme review taking place. So when the new government came in June, in July, the Chancellor announced a review of the new hospital programme. Fairly normal when a new government starts to try and understand what's the scale of the programme, looking particularly at the costs for each of the schemes and how they're scheduled. So that started in July. We are part of that review and we are expected to hear more about that review in January. So in terms of options for the Royal Berks, when we originally did the strategic outline case in 2020, we had 3 options to take forward. And that was a very high level case for change document. And the 3 options to take forward were 2 on-site redevelopment, partial redevelopment, because at that time the request was to outline plans to build before 2030. So to redevelop on the site, we could only redevelop part of that site by 2030. And we also had an option for a new hospital on a new site. Since then, we've done a huge amount of work trying to understand how to the issues linked with building on the current site, and there are a number of issues. So there are it's a landlocked site, so it limits the space to expand. It actually limits some of the construction that we were able to do. There are some planning restrictions that we have to take into account. We also have Hospital 2.0 requirements, so standardised designs and linking those standardised designs for a hospital of the future to some of our old buildings would also create some issues. And we've talked, I think, back at a previous board around some geological issues on the current site. So we did a huge piece of work on that. We call a viability report, and building on the current site will still be an option that we will put forward in our refreshed strategic outline case, but we have been also doing more work on a new hospital on a new site and exploring that option. And I'll come back to that in a bit because the impact assessment relates to that. This is a very high level view of the programme. So it's assuming that we will know our funding confirmation in February, so after the new hospital programme review. So it assumes that we know what our final envelope will be. And there are a number of steps then that we need to take forward to get to construction in 2031. So it's just outlines that we have a strategic case to do, and in part of that strategic case, which is strategic outline case, which is called SOC on there, SOC. As part of that, we have a public consultation process that we're planning for. So we have the options that to build on the current site, and we have options around a new hospital and a new site that's had a lot more work done to it. So we would need to and will be taking that through to a public consultation, and that sets out the process for a public consultation process before we submit our updated and refreshed SOC in 2026, 2025, 26. So that's kind of the phase we're in now, and you can see it as part of the wider programme plan picture. So as I said, we're waiting for the outcome of the review. We are just completing the first phase of the location-led impact assessment. The work from the impact assessment, so an impact assessment assesses the impact of moving the site, the hospital, from where it currently is to 2 new locations. We identified those 2 new locations through a process of mapping our criteria against our success factors and investment objectives, which we've gone out and spoke to various groups over the last couple of years around, and we had some input around the criteria for selecting a site from the public. We applied that criteria and scored the sites, and 2 sites came up as being high scoring, and we have carried out an impact assessment on moving the hospital to those sites in terms of moving the location. That is an information gathering exercise. We take the information that we've gathered from that impact assessment and put it forward to what we're calling a pre-consultation business case. Very complex process, but we have to put together, and the commissioners put together all the information that needs to go forward to a consultation process. So understanding all of the issues linked to moving the hospital is going to be extremely important, and it contributes to an options development process. So understanding a bit more of what the issues are makes us think a bit more about what are the options in terms of what services we need to have in the new hospital on a new site, if it was one of those 2 sites, and what we might need to leave in Reading, for example. So moving the hospital from central Reading to these other 2 sites poses some issues for the residents of Reading, and it's quite a high population there. So we want to look at what are the options that for that population, in particular, if we move that site. So it's a range of things that we have to consider, and we will identify areas that need further investigation, but also mitigation. So, and I'll come to that in the impact assessment work. All of this as well goes towards land acquisition. So understanding the issues with the site, with moving it, the issues to patients, to staff, to the community, but also wider issues in terms of due diligence. So, you know, understanding some of the environment and sustainability issues, carrying out surveys, all of those that information needs to contribute to a site selection process, which we'll be heading into, and securing options, viable options for consultation. So viable is really important here. So to understand there will be loads of options that could go forward, but some are more viable than others. So we will assess that against viable for our population and access, for example, but also viable in terms of affordability. And that's where it's important for us to know fairly soon how much our final envelope is in terms of our funding. So in terms of the location-led impact assessment that we've been carrying out, and population in West Berkshire have been involved in, we ran that between May and September. 2 sites which met the criteria were investigated further. There were staff workshops. Over 10,000 individuals contributed to this process, which is really a significant amount of engagement, particularly for this stage of the process. So we're really excited about the engagement that we've had. We've had one-to-one briefings and a range of other ways to engage people. This is an iterative process. So, you know, when we look at other sites and other schemes, so Hampshire, for example, they're just a little bit ahead of us in terms of they've just gone to public consultation. They had a number of iterations of their impact assessment because we're constantly going out and getting more information to add to that impact assessment. And it's really the first go at it, and it's already raised and identified areas where we might want to explore further. Thames Valley Park was one of the sites, and that's at the bottom of the A329M, and that's 2.2 miles away from the current site. And Thames Valley Science Park was the other site, which is 3.7 miles away from the current site. Some high-level things, obviously, the further away from the current site that we are, which is more centrally located in terms of Reading, the more issues for the Reading population in particular are raised in terms of travel and transport to a new site. So there's some key takeaways from the chapters. So these are the areas that we looked at in the impact assessment: health services impact assessment, traffic and transport, looking at the local economy, what it might bring and what are the advantages to the different sites, looking at the impact on health inequalities. So what we do know is that by moving the hospital to one of these 2 sites, it will pose more challenges for people who actively travel to work, so that's walking and cycling, but also public transport. And what we also know is that people in more deprived areas or who have health inequalities tend to use those modes of transport more. So we do know that we've got a bit of work to do to identify what we can do to mitigate against the risks of health inequalities for that population. So this first piece of work has been clear about that and identified that. What we need to do is look at what are the things that we can do to mitigate that. And there are a range of things. There are things around transport that we can do. And there are also a range of things around, sorry, there are also a range of things that we can do around bringing services back into Reading. So just in terms of the West Berkshire survey respondents, sorry, I'm just on the survey respondents, we had 9,600 respondents in total, and West Berkshire, who gave their postcodes, was just over 2,000. Some of the things that we've said, it won't be a surprise to you guys here what the main themes were. Obviously, there are concerns around access from villages. That is a concern now, around access from villages. There was a strong voice around the benefits of using satellite hubs. Again, that's no surprise. We get a lot of positive feedback around the West Berkshire site, how accessible it is. We even have people from Reading who want to come to the West Berkshire Hospital site. So we've got a lot of positive feedback around building the services more in those what we call satellite sites, which is part of our clinical services strategy, is to bring services closer to where people live. So that is part of the work that we're doing to right size our hospital, is looking at what are the things that we can bring closer to people. So that's a flavour of some of the feedback that we've had from West Berkshire residents. And just quickly on the next steps, we're going to take the impact assessment feedback that we've had. We're continuing to do due diligence. We're also continuing to do site searches. So we won't be stopping looking for other sites and investigating those sites right through this process up until the public consultation process. So we are working with land agents at the moment, and there's a constant review process of sites. So if there is any sites that you think we need to be looking at out there, then do let us know. We are constantly updating and reviewing those sites. We're heading towards an options development process. So we're looking at, particularly with a new hospital on a new site, what are the things that we would put in a new hospital, and there are variations on that, and what are the things that might go in our satellite sites. Do we need to create something in the Reading area, and what do all of those permutations look like? We have further work on travel and transport, making sure that if we are suggesting moving to other sites, that we have plans around what the travel and transport arrangements need to look like for moving to those sites, and those plans need to be costed as part of the process. And the same again with environmental and sustainability issues. So that's kind of we're also waiting for obviously the outcome of the review in January, but that's a skip through of some of the work that we have been doing, what the next steps are in terms of our process. So moving into options development to help us secure our land, but also to help us to have a suite of detailed options to take through to a formal consultation. There'll be lots and lots of opportunities to engage, workshops, focus groups, surveys. We continue to have front and centre that we would like as much engagement as possible with the population that we're working with. So I'm going to stop there and see if there's any questions.
Thank you very much, Alison. Yeah, it's good to see that you're confident that it's going forward. And I'm also pleased to hear that, you know, your strategy for bringing more services to local area, the hospitals, is good. So, yeah, we have a few questions. Paul Coe.
Thank you. Yeah, I wanted to say what a helpful presentation that was. I thought it was really clear and did speak to the issues that I wanted to understand. So I'm grateful for that. Also really positive to see, of course, the voice of the West Berkshire population has been, well represented. And to echo the point that you've just made, I think growing the satellite offer, something that would go down extremely well. Clearly, that's come through the responses already, but I'd certainly want to emphasise that point. I think it mitigates some of the points, some of the concerns that you've articulated related to access as well. So you kind of get a double win, I think.
Thank you.
Anybody else want to ask any questions or make any comments? No, I think that was testament to a good presentation, actually, that we don't have any further questions. So thank you very much for that. It was really helpful. So, and we look forward to hopefully, the green light in January to carry on. So thank you very much for the presentation. Okay, so moving on then to housing and health. Sean, can I ask you to present this one, please? Thank you.
Yes, thank you. Thank you, Chairman. So the origins of this paper go back to a focus group that we had back in June that a number of members of the board were at. I won't go into the report in detail, but effectively, I think the correlation between poor housing and poor health is well understood by everybody on this board. The basis of the paper as set out discusses in a little bit of detail, basically a housing condition survey that we had done in West Berkshire. And that was conducted basically in the early part of this year. It was a desktop survey, but it was undertaken by an organisation that are very well versed in carrying out these surveys. The headlines from that are set out at part 4 of the report. What I would stress is that the housing stock generally is good, but obviously when you look at these figures, you can pull out headline figures from that, but generally the stock is good. But nevertheless, there are the report would indicate that there are some properties within the district that have got problems and associated risks with them. And some of the risks that basically you can find within the Health and Housing Safety Risk Rating Scheme, which we as the Public Protection Service use, are set out at 4.3. And probably the most significant ones at the moment are issues around cold homes and excess. And stop there. Okay, I was wondering it was going to stop. So set out at 4.3, and the issues particularly around damp and mould and cold homes are very much on the agenda at the moment. But we do basically come across some of the other issues, particularly around installations, leaks, water supply disruptions, and occasionally sort of fire safety risks. So the report then goes on to talk about the current response in West Berkshire. So there is a section there that has been provided by Nick and the Housing Service that talks about some of the issues that they face. And at the time of writing the report, there were 57 individuals and families in emergency accommodation, and obviously there were associated challenges and costs around that. The report then at 4.13 onwards goes on to talk about the response of my own service. So just to clarify that within the Public Protection Service, we have responsibility for the for housing legislation that covers basically the rented sector. And as you can see from the earlier part, there is quite a number of, there is 17% of private rented, 11,500 rented properties in West Berkshire alone. On top of that, there were 9,500 socially rented properties. So it talks about our role in regulating the rented sector and housing, Our work also covers caravan sites, talks about some of the projects around conversions that we're doing, and some of the work that we've done around damp and mould, and properties affected by that and individuals affected by that. And then finally, basically, we have a summary in the report. As I say, the stock is generally good compared to regional and national benchmarks, but there are clearly things indicated in the report, basically, which we feel probably needs further exploration. And the suggestion that we've come forward with is that we need to look at a bit more detail around the stock condition survey, see how we can address some of the issues in there. So it would involve basically, looking at issues of cold homes. It would involve basically working with colleagues in the voluntary sector that are dealing with residents facing these challenges. So we regularly have conversations with the sector, and we do get feedback about some of the issues that are set out in the report. And then the proposal is to come back with the action plan that arises from that. There is one further recommendation in there, which I know that the membership of the committee, the board is under review, but whether basically there should be membership on the board relating to the council's own statutory housing functions. I'll stop there, and I'm very happy to answer any questions, but I hope it kind of summarises the whole issue and the current response. Thank you.
Thank you, Sean. I have one question. You mentioned about how many families were in temporary accommodation. Do we know how many of those were children?
I don't, unfortunately. I can get that detail and I will circulate that to the board. But that section of the report, I haven't got the detail behind it that Nick pulled that together.
Thank you very much. Yeah, Paul.
Thank you, and thanks again, Sean, for a useful report. I'm very supportive of. As Sean says, I think the links between housing and health are well understood. I think it's very sensible to say that we need a good representation on the board or membership of the board that reflects that. I suppose as well, I note the point about the working group, and that makes sense. But I suppose there is probably a consideration for us, and I don't want to preempt the wider review. But I wonder if when we're looking at our subgroups, there's something in here about having housing routinely, regularly reflected in the work that we oversee.
Thank you. I would agree with that. So, Matt.
Yeah, thanks, Chair, and apologies I can't be there in person today. Yeah, I agree with Paul, actually. I think there is something about subgroups, isn't it, and the review. But this is a really important issue, so I completely endorse it. My question, Sean, was just with regards to the interface with NHS. I know a lot of areas in the country are looking at damp mould in relation to respiratory, cardiovascular admissions and things like that to see if they could be a bit more proactive and reduce demand. Is that something that we've explored, or maybe is that something we could look at as part of a working group, or how we take this work forward?
Yeah, thanks for that. I mean, obviously, we do see individual cases where there are identified links or suspected links with health already. I think when we get into the working group to look at how we basically move this whole agenda forward, because I mean, going back to what you were saying, Paul, I mean, I've been on this board, I think, 2 or 3 years now, and I don't think we've really had very many discussions about housing, and I do feel it's a very, very important topic. So yes, I very much, Matt, we'll look basically to bring health into those discussions, but I want to look at it really, what I'm thinking is we need to look at the whole thing pretty holistically, and in particular things like cold homes and maybe opportunities for grants and things like that the council can apply for basically to assist with people. But going back to the wider issue of the health and the implications for the residents, I'm very, very keen that is all drawn together, and really this report is the starting point for that discussion.
Thank you very much. Denise.
Yeah, I actually had a briefing last week from housing, and there are 58 family, well, 29 single and 29 families in bed and breakfast at the moment. 38 of those have children. So there's 38 children currently in bed and breakfast, which is obviously 38 too many. And four women that actually are pregnant are also in the homeless accommodation. Again, totally unacceptable. We are working with the Ministry of Housing and communities and local government to sort of see if what we can, you know, there's anything we can do. But I think everywhere in the country is suffering the same problems.
Thank you, Denise. Helen.
Oh, yeah, I just wanted to endorse some of what's been said. I think the link between housing and health we're all very much aware of and would agree with what's in the paper. So I think having enhanced membership for housing on this Health and Wellbeing Board would make sense. Also really interested for us to explore some of the work that Matt and Sean are talking about with regard to the link to health and preventative work that we might be able to undertake collectively in that space.
Thank you, Sean.
Thank you, Chairman. Just to come back, actually, I lost my thread a little bit when I was responding to Matt, but one of the areas that we have been thinking about is what more we can do to promote some of the issues, particularly to residents. I mean, interesting enough, obviously, managing demand is always a challenge for all of us around this room, but actually these are areas where we really want people to report stuff to us. So that we can assist where we can and can carry out relevant interventions. So we did think about basically whether there was a public health based programme around raising awareness, Matt, in relation to not just tenants, but also to landlords about responsibilities and all the way through to letting agents.
Paul.
And I don't want this to become a rabbit hole, Heather, so, but I will put something out there. I'm aware that in some parts of the country, some really exciting, innovative work is being done using technology to monitor levels of damp, in particular, temperature and movement, because that's of interest, obviously, to the kind of well-being of the people living there, but also to the landlords and people looking after buildings, because you don't want, you know, it's a sign of an unhealthy living environment, and also it's not great for the building itself. So as I say, it's a risky rabbit hole, so I don't think you want to pursue it too far, but there are people in this board who might want to say, okay, let's look at that technology opportunity as well.
Yep, I understand that. So April.
Just to say, really keen to work with others around the sort of prevention model and how we might be able to get that information out to our residents through our libraries, our leisure centres. We've got lots of people using those facilities, and they can often be really good conduits to providing information, preventative information to our residents. So I think that would be really good.
Yeah, thank you. Yeah, any information we can get out, and I think this is, you know, if we can raise the standard of our housing stock overall, it will raise the standard of health, and I think we all agree on that. So you know, unless anybody's got any further comments, are we happy for the recommendations? Has anybody got anything they're not comfortable with on these recommendations? And Denise, are you happy to be the representative on this board? I sort of jumped you in there.
Of course, Chairman, no problem at all.
Thank you. So yeah, so unless we've got any other comments, I'm happy to take these all these 4 recommendations together and take a vote on them. So if you're all happy with those, do I have a proposer? Paul, and a seconder. Thank you, April. So all those in favour? Thank you very much. That's carried. That's it. You're on, Denise, now. Can't get away. So thank you, everybody. The next item is moving on to GP access. Fiona, are you happy to take this away for us, please? We can't hear you, Fiona.
Hello, can you hear me now?
Yes, we can. Thank you.
Great, thank you. Sorry about that. It wasn't, I couldn't get it to unmute. Apologies. Right, I will share the screen. So sorry, I'm having some troubles this morning. It's not wanting to do anything. Please excuse me.
Do you want to try again?
There we go. Can you see that now?
We've currently got a black screen. Ah, yep, there we go. Yep,
Okay.
we've got it.
Okay. Can you see that? Okay. Good morning. Apologies, Chair, for the technical difficulties this morning. I do, sorry about that. Yeah, good morning. I'm Fiona Warby and I'm the lead officer at Healthwatch West Berkshire. So I wanted to just give you a brief overview of a project that we did this year, earlier during the year, in conjunction with Healthwatch Reading and Healthwatch Wokingham. We did a GP access across the patch, and these are our figures for West Berkshire here today. So I'll just carry on. So the objective of the project, sorry, was to support GP surgeries to improve communication with the public. We had heard from people contacting us saying that, you know, they were having long meeting waits, that they couldn't get appointments. There was all sorts of little things that they were just coming to us, talking to us about. So we decided that perhaps listening to the public and finding out what was actually going on with appointments and long wait times, etc., was the way forward for us. So, and we also wanted to raise public awareness about the other pathways for support, because of course the new pathways had come into the GP surgeries about care navigators and new staff members. The public didn't seem to really understand or know about the new resources that had come into the surgeries. So we also wanted to increase access to services and reduce the complaints. So in West Berkshire, 132 participants took part, 93 through the online survey that we produced, and 39 through various focus groups that we held throughout the area. So the participants were diverse, came from different backgrounds, and we received various responses from lots of different people, which was really, really lovely to see, actually, because normally we have quite a small cohort of people that take part, but it was actually a really quite diverse community. We do have a lot more demographic data if anybody would like to see more in-depth reporting. This is just a very summarised part of the report. So what we found was the appointment access was really quite confusing for a lot of people. People were calling and then being told that perhaps they needed to go back onto the various systems and make an appointment through the .gp system, that they couldn't just turn up at the surgery. There was lots and lots of issues, and people were very, very confused and a little bit distressed, some people. So we kind of were looking at this, and also with the care navigation confusion. They wanted to know what training the care navigators had received, rather than just what was perceived as a traditional receptionist. And they wanted to know why they were being asked a lot more personal questions, which they weren't overly happy about. So we were looking at, you know, all of the different access routes into the GP surgeries, and also how the care navigator system could be explained a little bit more out into the public. Also, the digital service challenges that people were experiencing, that some people were being told to go and use the NHS app. Some people were told to use the online GP service app that they had, or to go online and actually just go through the website and log in there. So there was lots and lots of different ways that people were asked to access, and the older cohort of people were feeling very confused and very upset about this. So it was just really a kind of way of finding out what was going on and how things could be improved. There was quite a lot of communication from the surgeries in verbal communication, but there was nothing really available in paper format or poster format or anything in the surgeries for people to kind of see and understand that this was happening and the reasoning behind it. There was no, the video screens were not being utilised for the information for the public. So people felt that they had kind of just been, this new service had been thrust upon them without any explanation, and it would happen and then the explanation rather than the explanation and then it happened. So they were feeling very sort of not kept in the loop, as it were. So we had some quotes from the public that we went out to see, and the older generation were definitely more vocal about explaining to the care navigators about their problems, and they weren't very happy about that at all. As I said earlier, the training, they wanted to know what training the care navigators had received. They wanted to know why they were being asked all of these questions when the person they were speaking to weren't doctors or weren't a surgical person that would understand. So trying to explain about the triaging was very important, which we were doing when we went out into the community. Somebody said that, no one should be excluded. They did feel that they were being excluded, very much so. That the younger people with the smartphones could understand the systems. The older people, not so much. It was very much an issue for lots of people, but the older cohort of the people we spoke to were very concerned about this going forward. So the recommendations that we came to were appointment access, that surgeries should provide clear, accessible information on how appointments are shared out and the alternative options, with simple, clear routes to access how people can access the appointments. So this would be on their website, in the surgeries. We actually designed an infographic, which was a very simple infographic. It was just a care navigator in the system with the sort of triaging thing around, which explained who the people were in the surgery, what they did, and the access route into the surgery. And when we were showing this out to people, they were like, oh gosh, this has made it so much clearer. I understood it. This is what I would like to see. So we kind of suggested that a visual representation, bearing in mind that not everybody speaks English, that the reading age across the nationally is 11 years plus, and so it was quite important to have visual representations of how people can access things. Also, the digital service challenge, with people being able to access. Some people just said, I absolutely cannot do any digital at all, but we're still being asked to go back and go online or go through the NHS app, and so we've asked that a flag be on each patient's record to indicate whether this person would be able to use digital services or not. And then the communication gaps. We did think that surgeries would benefit from sharing timely information on changes or updates to services. Now, obviously, this isn't always, it has to come down and filter down. And obviously, surgery is under immense pressure. We do appreciate that. And getting the comms out is not always easy. So we do understand that, and we have explained that out to the public. But we're always happy to kind of help and put anything out that we can as well. So we also wanted to ensure that easy reading, accessible language is available, because currently it doesn't seem to be. So we have suggested that these options be made available to the public too. So that's it. So thank you. If there was any questions that anybody would like to ask, please do.
Thank you very much. Really interesting presentation, and I read through some of the comments on the papers that came through as well. So thank you. Paul.
Thank you, Chair. Thanks, Fiona. I suppose I was most struck by the responses at the back of the papers in the pack. So the obvious question is, how is your report being received? How many primary care representatives have received it? What do they think of it, and what are they doing with it? Because it read, I mean, you had two responses in the paper, and one of which was quite well, I don't know. It didn't feel like the points you were making had landed in a particularly well received. So what can you tell us about that?
Yeah, so we sent it out to the primary care, everybody that was involved actually, because prior to obviously doing the report, we did have meetings. We did discuss with primary care about this, that this is what we wanted to do, and basically we did speak to some of the doctors about, you know, what sort of things were they looking for. We sent our list of questions to them, and they checked them over for us, that you know, if they wanted to add anything they could. And then when we sent it back, so that was Abid and Sanjay, I think, that replied. I think they felt that they were trying very hard to improve everything, but that there was a lot of changes happening, and also that because when we started to do this report, it was, or the project, it was quite a long time ago. It was well over a year now. So we were very much delayed in getting the report out to them, and things had moved on. So we did take that into consideration, of course, and we did discuss with the doctors that obviously we understood that things had moved on, and you know, we would like to kind of understand what they were saying. However, we are still hearing the same issues, and we have gone back and explained this again to them. So we are still, this is still ongoing with the primary care network at the moment, and so it's very difficult because things are being changed. They definitely are, but the public are still feeling that they're not being made aware of the changes. So there's lots of great things happening in the surgeries, and they really are absolutely fantastic, but it's the public's perception of them is still not there. And the GPs are kind of a little concerned that, or they're doing their hardest to get these things out, but there's still that sort of backwards and forwards from the public to the surgeries that I don't know about this, I still don't want to talk to this person, etc., etc. So we are trying to work with them to help resolve the communication out to the public, really, I suppose, is the best way to put that.
Thank you. Paul, did you want to come back on that?
Thank you, Chair. Yeah, I suppose, so I'll make a couple of points. Primary care is so important, and I don't think for a moment that those people leading primary care are not motivated to deliver the best service they possibly can. So I do think there's probably some reflection also for Healthwatch in terms of how do we get enough buy-in with the people that we're assessing or reviewing, so that we can kind of harness the enthusiasm and the dedication in service providers, and in such a way that it will help them to get better, rather than end up potentially with a kind of a thanks for your report, I don't like what it says kind of thing. So
yeah, no, absolutely, I totally understand that. And we are trying to work currently across the GP surgeries with the PPGs to encourage lots of conversations, you know, about things, how Health Watch can support and help, you know, because it's not that we want to go in and put complaints in. It's literally just trying to help improve communications. So we have a senior engagement officer working with the PPGs. We are in constant conversations with the doctors and primary care about these things happening. So hopefully, you know, yes, it's going to, and you know, they are working incredibly hard. There's absolutely no denying that.
Thank you, Fiona. Helen, and then I'll come to you, Denise, in a minute.
That's better. Sorry, wrong button. Yeah, thank you for presenting the report, Fiona. So I have seen this report at a number of health and wellbeing boards now, which I think is really great because we do recognise that there's some really important feedback within this report. The point that you just made around the patient participation groups, I think is really key. One of the challenges with primary care is that arrangements do vary between practices, and therefore that real sort of engagement with patients of individual practices about their experiences and supporting practices to work with their PPGs to develop and improve services is really key. You've got within the report the response from the ICB. I think that shows that we very much welcome this further feedback. Sanjay has highlighted the work that we had been doing concurrently around the primary care strategy, which also involved a high level of engagement activities with members of the public and patients. And hopefully this will sort of complement that activity, both in regard to what's happened so far, but also the ongoing engagement that we want to continue with as we move towards implementation of that strategy. So yeah, I think Sanjay response sort of reflects our hope to continue to work together with you. And I think that also applies with regards to how you engage practices and GPs directly to share this information and in ensuring that they're aware of this feedback. And are able to work with you around how we further build some of these messages. I mean, these aren't new messages for the public. You know, we've been doing a lot of work over a number of years now to talk about new roles in primary care, to talk about new ways of working. But I think it has to be clearly an ongoing dialogue, and the fact that the messages aren't necessarily fully getting through to everyone means that we need to continue to work collectively to achieve that. Thank you.
Thank you, Helen. Denise.
I was just going to make a point that some people don't go to the doctor very often. And the first I heard about a care navigator was when a friend of mine said that she'd phoned up, she lived in Gosport, and she said that she'd been talking to a care navigator. I said, what on earth is one of those? And so, you know, I still, for my surgery, I would have expected still to speak to a receptionist. I know now that I speak to a care navigator, and I know that there's so much more than a receptionist. But people that don't go very often won't know that, and they will wonder why they're being asked personal questions, you know, more personal questions than in the past with a receptionist. So April mentioned earlier on about having pamphlets in libraries about doing different things. Can we not have a pamphlet? And I'm not sort of an advocate of having lots of paper, but can we not have a pamphlet in the library that says, you know, this is a care navigator. What does a care navigator do? You know, what does a national health an app do? You know, how can you get how can you get on an app? Do you know that you can now get your tests on your app? All this sort of thing just as a pamphlet that maybe we could have in libraries or, you know, or doctors' surgeries necessarily. Just a thought. I'm new to this, remember.
Thanks, Denise. And I'm interested then, Fiona, in the infographic you talked about. Maybe that is something that we should be sharing as part of that, because I can't remember the last time I saw a doctor, and I had no idea until fairly recently reading all the papers that was a thing. So yeah, I'm a bit like Denise. So
yeah, I mean, the infographic, you know, the public seem to really like. I think, you know, we kind of have put it out to the primary care services to say, you know, is this something that perhaps you would like to use or whatever, or design your own, or but I think it's really helpful for people to actually view something, I think it really does help, and having it in the surgery, because people sit there, and of course a lot of magazines are not available in the surgeries now, like they used to be. You could sit and thumb through the magazine and things. So I think, you know, little things like this people could look at, and it would explain, you know, there are, but I believe some pamphlets around with the information on Denise. But I haven't seen any in the library, but I think there is something from the NHS explaining these things. I know there is definitely a video with all of these new ways of working. And we did show some videos as well out to the public when we did our project report. So there are things out there. I think it's just the difficulty is the public awareness, because you don't need it until you need it, I think, is the thing. And the people do miss a lot of information. It's such a lot of information coming to people all the time. So until they need it, they don't realise that it's already there. So it's just getting that sort of constant everywhere all the time viewing.
Okay, thank you very much. April.
Just to say, really supportive of Denise's comments about being able to put things into the libraries. We'd be really keen to support with that. And we held a community, the Building Communities Together team held a community forum online on Tuesday evening. And the feedback that we were getting was, particularly with some of our older residents, that they really do like to have leaflets still. And for some, reading can be tricky. So it was suggested that infographics and diagrams are really helpful for some of our residents. So that kind of concurs with some of the things that you've been saying. But any way we can help with putting information out through the libraries, we're really keen to be involved in that. And we do have a digital officer within the libraries as well who can assist. So if somebody wanted to know how to download the app, I think that's the type of thing that we could help with as well.
Okay, thank you very much. Thank you, Fiona. That was really useful. So any other comments from anybody before we move on? This is just to note this report, and we don't need any votes or anything. So, okay, thank you very much. Right, item 11, pharmaceutical needs assessment. Stephen, are you taking this one?
I believe I am, Chair. Thank you. So this report proposes the method, oversight and approval for the pharmaceutical needs assessment. I'm going to go into acronym mode now because that's a bit of a mouthful, so I'll call it PNA from now on. The PNA is the local statement of current and future need for pharmacy services for the area. And it's used to inform decisions about market entry for new community pharmacies and changes to opening hours and services that are delivered. It's a statutory duty of the Health and Wellbeing Board to produce one, and the current PNA expires in September 2025. And here we're presenting the outline of the plan for producing a new PNA from that point onwards. So the options for the Health and Wellbeing Board that we considered in this paper are firstly around nominating a Health and Wellbeing Board member to take responsibility for discharging this duty, and the second aspect is the reviewing and the approval of the PNX being done by the Health and Wellbeing Board itself, or delegating that to a steering group. So we're recommending on the first point, nominating the Director of Public Health to take the responsibility for this, and to agree to set up a steering group for the reviewing and approval of the PNA, because that will be more responsive and agile, and also be able to bring in specific expertise from partner organisations. On that particular point, a Bob-wide PNA steering group has been set up to coordinate and facilitate PNAs across the ICS, but we'll also need a local steering group which will report into the Health and Wellbeing Board specifically on this. So I think that's it, Gordon, isn't it? That's the recommendation, and there's a project, an outline of the timelines that we're looking at in the appendix.
Thank you very much. Anybody have any questions? And Matt, did you want to add anything?
No, I don't think so, Chair. I think it's relatively straightforward. So it's just really for the board to just give approval to continue with the process, and then the final report will obviously come back later next year for endorsement. But this is a really important document. I think we've already seen over the last couple of health and wellbeing boards, haven't we, around new pharmacies obviously coming online or proposing to be closed. So it's important we get this right.
Thank you. Yes, I would agree. See, it does seem to come back to every board meeting that we talk about pharmacies, and actually out in the wider public, I see it and hear from people that, oh, I had to queue for half an hour in Tesco's or wherever it is, because the perception is there are not enough pharmacies. So yeah, I welcome this, and it would be good to get it moving. Paul.
Thank you, Chair. Yeah, I was just going to say, as you say, there was a report, wasn't there, recently that said West Berkshire is at the bottom of the table in terms of available pharmacies, and quite a lot of attention from our local MP and others. So I do think there's something useful. I wonder if, Stephen, you could link in with our communications team so that people are reassured by the fact that this work is going to be done, and it will give us a clearer insight into the availability and sufficiency of pharmacies.
Thank you very much. Right, if everybody's happy, then we'll take a vote on this. Do I have a proposer for this, please? Paul, seconder? April, thank you. Is everybody in favour, please? Right, thank you very much. Look forward to getting the updates on that one moving forward. Right, next item then, cost of living update. Sean, would you like to present, please?
Certainly, Chairman. So this is probably the fifth or sixth in a series of papers that have come to this board. I mean, we are looking really to kind of keep the whole issue on the agenda here, and I think at the last board meeting we did discuss whether these reports should still come here, and the view was that they should. So we recently had a meeting with the voluntary sector. Councillor Gaines was there and may wish to add to the discussion today, as was obviously Rachel, who chaired the meeting. So I think what this paper basically sets out is a story of increasing demand, and that's increasing demand both in terms of the household support fund and the applications to the council. So you can see in the report that within the first basically 5 or 6 weeks, there were 579 applications for the household support fund, and you know, that's basically half of what we had for the whole of the previous 6 months. So that's an increase in demand. And then when you look at the report and go through the various updates from the various voluntary sector charities and support organisations, again, you can just see that basically increase in demand sort of year on year and almost month on month at the moment. There are some issues that did come up in some of the discussions that we have had. Clearly, one of the things that is focusing minds at the moment is the loss of the winter fuel allowance potential, you know, in relation to a large group of the older population and the implications of that. And I know work is going on in that area to try and help people onto pension credit. But just really to say that there are still significant issues out there basically for a number of residents, and there are still challenges basically for a number of the organisations that are mentioned in this report, and also basically for the authority. The proposal is that we just keep this on the agenda, keep coming back. I have had a conversation with Rachel, I think it was this week, wasn't it, Rachel? And I did in fact have a conversation with Paul yesterday about the approach that we could look at in relation to the next round of household support funds. So the positive is that the governments have announced that there will be another round starting in April. And again, I think we need to start the discussions early, I think was the feeling, as to basically how that can be best used to deliver the support that our residents need. I'm happy to answer any questions. I don't know whether Rachel or Councillor Gaines wish to add anything from the meeting.
Yeah, do either of you wish to add anything to that?
Not specifically from the meeting, Chairman, but I am a bit worried about the renters bill that's coming, that's being put forward, and the problems that may occur with the lack of rentable housing, because landlords are getting out of that environment due to the sort of the no fault evictions being reduced, and obviously there are other things, rightly things putting in in the way for them to actually sort of conform to things. But nevertheless, I think a lot of landlords may get out of the renting arena, can't even say it, because of that situation, and that means that we will then inevitably end up with more people on the homeless list or on the housing list. So that does concern me a little bit. Thank you.
Sean, did you want to come back?
Yeah, I mean, I did pick up on this in the last report, and I think it's even touched on in this one about the potential for sort of unforeseen circumstances as a result of the legislation, which, you know, seeks to embed, you know, good housing standards and everything else, and obviously the end of section 21 evictions basically are proposed in there. But whether there could be implications in the run-up to the bill, as Councillor Gaines has said, this is something I think what I have proposed, again on the previous paper, was that we come back once we know more about the implementation timetable of the bill and everything else with a report to this committee, to this board, to address those points as well.
Thank you. Matt?
Yeah, thanks, Sean. Really helpful report and really important. I know you referenced the national insurance contributions, and I was just wondering what's the intelligence we're getting from the community and voluntary sector around this, because obviously they are supporting some of the most vulnerable people in our communities. And I was wondering, are we getting an understanding of what the implications of that's going to be for their particular organisation? I see Rachel's hand's gone up, so she might want to comment on that one.
Yeah, we'll bring Rachel in at this point. Thank you.
Thank you. Yeah. So when the budget was announced, we did some initial engagement with the sector just to ask if there was some initial idea of impact. We've had about 16 charities, organisations come back to us. The national insurance contributions is going to have a financial impact of about £455,000 on those 16 charities alone. As to what that means at the moment, they're still kind of unpicking, you know, but it will potentially have an impact on service delivery, you know, either not being able to offer all of the services they currently do, or having to look at, you know, reallocating staff or you know, whatever to make some of those, you know, those budget numbers work. I think a forum yesterday, the question was asked, you know, what are we going to do? Well, the charity sector will just carry on, but they will have to find the money from somewhere. You know, they'll have to do more grant applications, or they'll have to be more creative with how their money is spent, because the charity sector just do that. They just get on with things. But I think the reality is funding is challenging. It was challenging before cost of living. It's going to be even more challenging with the, you know, with the budget implications. One of the things that I did agree to take away as an action yesterday, and I think it's something that I've seen the voluntary sector, the Bob Voluntary Sector Health Alliance do, is a more detailed survey. So at the moment we've got some figures and we've got some kind of written feedback on the impact, or what they think might be the impact in terms of service delivery. But I'm going to do a more tailored survey to go out in our bulletin to see if people are looking at things like resignation, restructure, and try and piece together a bit of a better picture. Max, as say, we did an initial response, and a letter has gone to our local MPs. I've got a meeting, I think, later on today with Lee Dillon, and hopefully he's seen that letter and we can have a conversation about what, if anything, you know, he can raise in Parliament. But yeah, it is a concern.
Thank you, Rachel. And April.
Yeah, just in response to Sean's report, just to say that we did run some sessions in the libraries just recently at Newbury and Theale, providing advice and support to our residents around the Household Support Fund and also around pension credits. And they were in the Newbury Library, had 30 inquiries, 30 residents that came along and asked for help and support, and 10 inquiries at Theale, which was really good. And just the thank some of our partners that came to attend that session. We had the Department for Works and Pensions for Berkshire, Age UK, Citizens Advice Newbury, Fire Service, also Sovereign Housing Financial Support Team, our Revenue and Benefits team, and some housing colleagues, and also members from the Building Communities Together team as well. So it was a really successful events that were run, and certainly something that we'll be looking to do again in the future.
Thank you. Yeah, I think that was really good. Are we planning on doing anything out, further west towards, Hungerford or Lambourne at all?
I have spoken to Elizabeth about the possibility of being able to do that. So that is something that has been flagged with her, and hopefully, yes, that's something we'll be able to do going forward. Because
the people at that end, they're that much more remote, especially around Lambourne. It's harder to find things. But no, it was a good initiative, that one.
Yeah,
so.
And it was good to do those first two to see how they went, and if it was the sort of thing that our residents would come along to. And I think that's given us the evidence base to say, yes, it would be good to roll those sorts of things out further.
Thank you very much. And thank you, Sean, for the report. And it is critical that it keeps coming back. We need to keep this in the public eye. There are people out there really struggling. So, yeah, thank you. Right, we don't need to vote on that one, just note the recommendations. Moving on then to items 13 and 14, the Better Care Fund monitoring reports. Paul, over to you.
Thank you, Chair. Yeah, as you say, quarter one is here for completeness, but quarter two makes sense to focus more on that. The eagle-eyed amongst you will have noticed that there's reference to 5 metrics and only 4 are listed. There are indeed 5 national metrics. The one that's missing from the paper, I'm afraid, is reablement, although I think our performance on reablement I don't have the figures to hand, but I believe our performance is improving on reablement. So we recognise, of course, avoidable admissions is a really important area of performance that we are short on at the moment. But it is great to see people being discharged to their usual place of residence. That's an area that we've had some difficulty with in previous years. So happy to take any questions.
Any questions from anybody on this? No, you got away light. Thank you, everybody. Okay. Again, it's useful that these reports come back to us. Right then, item 15, Joint Health and Wellbeing Strategy Delivery Plan. Matt or Stephen, are you doing this one?
I'm doing this one as well.
Thank you.
Thank you, Chair. So this report's just to give an update on progress on the Health and Wellbeing Strategy Delivery Plan, noting the intention to update the plan after the LGA Health and Wellbeing Board review. In the interim, it's proposed to remove actions which have been completed or cannot be progressed. They're marked in Appendix B. Of the live actions in Appendix A, 17 are green or on track, 5 are amber and 6 are red. They're looking through them, there's some really positive progress, and I'd particularly highlight the following actions. Firstly, we're continuing to deliver regular public health and wellbeing comms and messaging, and are investigating whether this can be delivered more impactfully, including more sophisticated social marketing for a few specific campaigns per year, which would require some specialist support. Secondly, the Health and Wellbeing Board Conference 2025 themes and how that's going to run to be discussed by the board. And then thirdly, the progress in development of a suicide prevention action plan, which is in progress via the West Berkshire Suicide Prevention Action Group, which is currently surveying partners on the existing activities that will fit under the Berkshire-wide suicide prevention strategy to identify any gaps and to inform the action plan, and that will come to the Health and Wellbeing Board next year. So the recommendation, please note the progress and agree the interim changes to the plan ahead of the LGA review.
Any comments or questions for Stephen? So, no? Okay. Carrying on then. Thank you very much. Report is noted. I think we just want to get on with the review now. I think that's the thing, isn't it? So keep adding more onto it. So, right. Item 16. Helen, Bob ICB update.
Thank you, Chair. So this is our standard update to health and wellbeing boards. I won't go through all the detail, but just to highlight a couple of key things. Firstly, we draw the board's attention to our board meetings and the availability of papers for those meetings on the Bob website. The ICB operating model I already referred to earlier in the meeting, just to say there's a little bit more information here provided with regard to place working and how we'll be liaising with our local authorities going forward. And as I said earlier, a further communication with details of progress on the appointment process and arrangements for exec director leads will follow next week. We've also provided update with regard to, or mention with regard to GP collective action, linking to the primary care access discussion we had earlier, just to say that we are continuing to monitor any impact of that, and will obviously provide further detail if required in due course. The update talks about the evaluation of the hospital at home services across Bob, and some of the early findings of that evaluation, which are largely positive. I think members will agree, and there's some detail of that within the paper. A further item to highlight is the winter vaccinations programmes currently ongoing for flu, COVID and RSV. Generally good uptake so far. We will be able to share more detailed uptake information in due course, but generally the programmes are going well, and particularly the RSV vaccination, currently around 43% uptake amongst eligible patients. And then finally, we just wanted to draw the board's attention to the Change NHS National Engagement exercise, which will be feeding into the development of the 10-year plan for the NHS, which is due to be published next spring. So there's details within the paper, but just really encouraging people to have a look at that resource and to input as appropriate. Thank you.
Thank you very much. Paul.
Thank you, Chair. Some positive stuff in here. I think it's probably important for us to note regarding the operating model that there were significant reservations expressed by all 5 of the local authorities in the Bob patch about elements of the operating model, particularly on what we perceive to be the dilution of the function of place. In other words, a sucking up to the centre of functions which we felt could be better managed at a Berkshire West level, or indeed a local authority level. I think we are where we are, and I think the optimist in me says it'll be fine. But I do think this board needs to be cited on the impacts as we perceive them relating to the operating model over the coming 6 months, 12 months, and so on.
Helen, you want to come back?
Yeah, thank you, Paul. I mean, I think that was really a point to note, wasn't it, for members of the board? Just to say that in addition to the communication that I described, we have also committed to providing a further update on the implementation of the operating model, which was covered in the actions earlier on in the meeting. So yes, we'll continue to provide information around that.
April.
Helen, one of our residents the other evening at the community forum raised a really, I thought, excellent idea, is that when you do the winter vaccinations, obviously that's often older people, some of our more vulnerable populations, how we might be able to link with you to provide information out to our residents when they're coming to those vaccinations, because you've got lots of people coming along who we might want to give information about staying well and healthy during winter, also about things like pension credits, household support funds. So we might be able to put leaflets together. Might be something we need to work on maybe for next year to get that in place, but just obviously not for an answer now, but just to flag that and to think how we might be able to work together to deliver that.
Yeah, thank you. I think there have been some pieces of work done previously around taking the opportunity to share information. But yeah, absolutely happy to feed that back to the vaccinations team and make sure that we look at that further.
Thank you. Any other comments? No? Right. Thank you very much for the report. Thank you. Right. The next item is the subgroup from this board, the subgroup updates, which are provided on your pack. Were there any items that anybody wanted particularly to comment on these? No. Okay. Well, thank you. We'll take those as noted. Then the next item is any member questions. Gordon, have we received any?
No member questions have been received this time, Chairman.
Thank you very much. And then we move on to the forward plan. I'm trying to find the right page. And just to note on there, at the steering group recently, it was agreed that we would move the annual conference from April to June so that we get the LGA review done. Again, we're waiting on that one to get sorted, and then we'll sort out the conference from there on timing and subject, etc. So has anybody got any updates or questions on the forward plan? Paul.
Just as previously discussed, Chair, it would be useful to come to the May board with an update on the community wellness outreach project.
Thank you. Yes, that would be really useful. So, Sean?
Yes, Chairman, I was just going to suggest that at some point into next year, it may be worth having a look at the new tobacco and vaping legislation, of which the vast majority, in fact, I think probably all of the enforcement will fall to the council. So it'd be interesting to look at some of the implications around the implementation of that work.
Yep, thank you. Yeah, have you got that one then, Gordon? Thank you. Add to the list. Anything else? No. Okay, so the next two meetings are March the 6th and May the 8th. Thank you everybody for attending. We're all feeling a bit lonely in here. I know December's not always the best time for travelling, but we would actually like very much to see more of you in person. I much prefer an in-person meeting. So, but thank you everybody for attending anyway. So if the Zoom host can let us know, and we'll close the meeting. Thank you.